a lot of our female patients have asked about is the relationship between weight loss and menstrual cycles. Mike, this is something that can cause a lot of anxiety for our female patients. What are your thoughts around this?
So there's all sorts of things that can affect the menstrual cycle and therefore the regularity of periods. There's a very complicated interplay of lots of different hormones and predominantly four. And there's lots of different things that can affect those four hormones. So it's unsurprisingly, we don't fully understand how a certain rate of weight loss may impact periods. But speaking generally, we know that rapid weight loss can cause people to develop irregular periods, more weeks between periods, or even stop having periods. So we know that rapid weight loss can definitely cause that. Gradual weight loss is less likely to cause that, but because we are adjusting hormones in the body and they have downstream effects to these four critical hormones that deal with the menstrual cycle, it's very hard to know whether you as an individual are going to experience it. Safety perspective is that even if you are experiencing irregular periods or no periods when you're on a weight loss regime, as long as you feel relatively well, that's a good sign. That's the first thing. But if you are feeling unwell with it, don't ignore that. See a doctor about it because it could be a side effect of the medication. It could be something else that's going on. The other most important thing is just because you've stopped having periods and have got irregular periods, it doesn't mean you are not fertile. So it's really important that you carry on with contraceptive regime if you've got a male partner, because it is perfectly possible to fall pregnant. So don't be misled by it. There's so many other factors involved here. It's quite hard to guarantee to somebody that they won't be affected, or if they are affected, that they will get back to normal.
That's really, really insightful. I suppose there's one way that you can track it would be using your period apps or just keeping a diary of any significant changes within your menstruation cycle. And you mentioned contraception. So the recommendation would be that you need to be on a most effective contraception while you're on weight loss treatment.
Yes.
What would be the reason for that?
So there is it's the effects of Mounjaro on potentially developing embryos. There's a lot that's not known, and when there's a lot that's not known, we are extra cautious. Pregnancy is a state where you generally need to carry excess calorie storage because you are helping a fetus develop, and that is something that consumes a lot of energy. So it's not helpful for fetus development to be on a weight loss journey. I would say that if your plans are to become pregnant, Mounjaro is not the right thing to be doing right now. You need to be exploring optimal weights for pregnancy with somebody appropriately qualified in either a GP with special interest in that area or a fertility medicine gynecologist. So yes, it's not the right time to do that, is what I would generally say. And there are lots of unknown effects of a new medication. And just to define a highly effective contraceptive, that doesn't actually include the pill. The pill helps, but by highly effective, we mean something where we've taken out the human failure element. So we are talking intrauterine devices, whether it's the hormonal one or the copper one, implanted hormonal devices as well. Of course, surgical sterilization is another one. Or if your male partner has had a vasectomy and has had a proven effect of the vasectomy, they all count as highly effective.
So going back to kind of summarize the question from our patient who was concerned about effect of Mounjaro on the menstrual cycle would be to monitor it, record it, bring it to your healthcare provider's attention. If you are experiencing significant changes to your bleeding pattern, heavier than normal, or you've completely kind of have stopped your menstruation, it's really, really important to discuss this with your healthcare provider.
And don't assume that you're not fertile.
And don't assume that you're not fertile, absolutely.